Hi, welcome everybody. It's Kevin Bradley here with another A.W.A.K.E Facebook Live event. Wow, it seems a while since we've done one of these, but I am delighted to welcome Cyndy Michaels, who's a respiratory therapist. And for the past 10 years, or for not the past 10 years, sorry, she was working as a respiratory therapist for 10 years. And then she moved to a sleep lab that she's been working for the past 19 years. So Cyndy is also running an A.W.A.K.E group. So we decided, Justine, Teresa, and I, in the summer of last year, that we would put out a new curriculum for coordinators that are running groups like Cyndy does. And, we hope that this will be helpful for people. We decided to do this because I guess, we wanted to make our messaging consistent. This module, the first module, is obviously for newly diagnosed patients that have just been diagnosed with a sleep apnea disorder, for the want of a better word. But we encourage everybody to stay on, and watch the presentation because, we can answer questions and look at things of trying to overcome problems when even newly diagnosed people have, but some people we see in our Facebook Live questionnaires that some people are still struggling like they're newly diagnosed. So Cyndy, I will hand it over to you. And if you want to just tell me a little bit about yourself, even though I introduced you, and start about talking about how you run your groups.
Sure. So I've been doing it for, I think, since 2007, running support groups. And we do have between 25 and 50 people who come to the meetings, and it's quarterly. So, I think it's a pretty good group, and everybody talking together is very important. And also a lot of the DMEs and manufacturers also come to the meetings, and they, the attendees really like to speak to them as well.
Great, but I think, one of the good things about your groups is, you also help people navigate through the system, which we'll get to later. And I think it's very important as well that you also follow up with people's adherence. So, can you tell me a little about how you do that?
That's actually a little more tricky. But we try to, check on their compliance. A lot of the stuff now is on the computer. So, with the different manufacturers, they have their own stuff on the computer. So, the patients can go in and look and see, what they're doing just as well as we can. We have a clinic that we have the patients come to if they're having issues, and we also have them come to the clinic to see our sleep doctor.
Great, that's a great service. And I think, the slide I'm hoping, obviously people can see. So, when someone's just prescribed a CPAP machine, what's next? And Cyndy, I'll let you take it away, like you're running your presentation.
Yeah, okay. All right, so I just wanted to say thank you for inviting me to speak this evening.
I appreciate you coming along. And I actually meant to say that earlier. It's nice when, we reach out to people in our group and people are willing to do this because not everybody likes to come on camera. And so we're very thankful to have you. Thank you for joining.
Thank you.
Yes,
and I'm happy as well to have Justine Amdur on board. Welcome, Justine, back from Tahoe. So Justine will chime in as well, and we'll take questions. Please send us your questions because we want to make sure we can try and have the best out of this as we possibly can.
Yes. Okay, I'll move to the next slide.
All right, so you were diagnosed with sleep apnea, or ASAA and was prescribed a positive airway pressure or a PAP machine. Now what? So I remember when I was first diagnosed, my thought was, oh no, now I'm going to have to wear one of those crazy looking machines and the masks and, trying to figure all that stuff out. And I'm sure other people, felt the same way. Next slide. So it is very important to understand your diagnosis. There are so many medical terms thrown at you. Sometimes it's hard to know what the doctor is talking about, especially with all the abbreviations. But the first thing you want to do is find out what is your main problem. So for the majority with sleep apnea, the main problem is you either stop breathing and or your breathing is so shallow it lowers your oxygen level while you're sleeping. So the first thing you need to do is have a face-to-face with you, appointment with your doctor, and make sure that you ask your doctor as many questions as you need to. Do not feel rushed at all. And if you don't understand the answers, ask again. Ask about PAP and what it is, how long it will take to get your machine, who will give you your machine. The doctor usually calls a DME, which is Durable Medical Equipment Company, or an HME, a Home Medical Equipment Company, who will either bring your machine to you or you'll go to the company and get it, and even sometimes it's mailed to you. But I would definitely ask the name and the phone number of the company. In my experience, sometimes it can take 2 to 3 months to get set up with the equipment. You're waiting for the doctor's office to send the prescription, the insurance company approving it, the company getting in touch with you, and then making an appointment that's going to fit your schedule. So sometimes that all that together can take a really long time.
Right.
It shouldn't, but.
And, not to interrupt you there, but I think that's, with anyone who's been given a new quote unquote diagnosis, it's very overwhelming. And I think, in this day and age, it's nice to be able to sit and think about what's going on with my condition. What can I ask the doctor? Write down notes. It's very beneficial if you can bring someone with you to an appointment, because sometimes we're all very, foggy about, oh, this is affecting me, but somebody else may be able to act as your advocate. And, take notes as well while you're at the doctor's office to make sure you're getting the treatment and, everything that you need answered, because that's a very important visit. And you need to understand what the implications are of having a new diagnosis.
Yeah, exactly. So make sure, that you ask for the name and the number before you leave, because you don't want to get lost in the shuffle either.
Sure. And Justine, I know we've all been there, we've sat in doctor's offices and, you've been told something, any experience or, light that you can shed on that experience that you had?
Yeah, I think one of the things that you said about, kind of having a little bit of that brain fog and trying to understand, what's going on, that happens with a lot of health conditions, and especially with people that have sleep apnea, because for the most obvious reason, you're not sleeping well. And so, that's where the brain fog comes from. You're just tired, fatigued. And so, you can't remember certain little details. So either writing everything down, if you can't have someone go with you, or bringing someone, I think that's a great suggestion. And also, I just want to mention that, our conversation today that we're having with you on Facebook and, with Kevin and Cyndy here is very similar to our A.W.A.K.E program, our nationwide peer-to-peer support groups like Cyndy has in her area. And these are the types of conversations that take place there. So maybe take a look to see if there's something in your area, or if there's not, go ahead and consider maybe starting one or talking to your doctor, because it is helpful to hear other patients' stories and what they're going through and how they overcame things, because we're all facing the same problem. I'm a patient as well, so.
Yeah. You know, and when I was doing this and when we were actually working on the curriculum last year, you know, time gets ahead of you sometimes, and I'm due to actually get a new machine soon, so I'll be going back to my DME. But it actually motivated me because the tools are out there. We've provided the tools for people to start a group. And there's some areas, you know, in your neighborhood, in your state, wherever you are, that may not have that peer-to-peer support. And it's very important. I am impressed that Cyndy has 25 to 50 participants. I think it's great, even what we see in our A.W.A.K.E page on Facebook, that people share experiences, they help each other, because even though we're going through a therapy ourselves, we may not have all the answers because we're not experiencing the things that maybe people experience out there. So I really encourage people to, you know, write that down, talk about your experience, ask for help, and somebody else that's going through the same issue may be able to help you. So again, it's actually when I go to my DME office next week, I'm actually going to ask them if they have a group, and I'm going to consider running one myself, thanks to Cyndy's work and the work that we're doing on our curriculum. So please stay along and feel motivated.
Yeah.
I also just wanted to say, even if you have a PAP machine, with all the advances in equipment and therapies, it's really a good idea to ask about new technology.
Of course, yeah. Things are changing all the time, and what fits today may not fit tomorrow.
Right. Well, the new thing, just to touch on that for a moment, I mean, they're always coming out with new and different masks. You know, the mask that I started out wearing is nothing like the mask I'm wearing now. I enjoy the one that I have now 10 times more. So, you know, by working with your DME, or the other acronym that Cyndy said before, I can't remember what she said. HME, you know, you might be able to see some new products that are out there. Are we going to go through questions 2 and 3?
Well, so 2, I think we already went through.
Yeah, one thing I just wanted to mention in regards to number 2 was that for people that are new to their diagnosis and getting their equipment, when I read question number 2, I kind of thought about, you know, what do you need to do? Well, you need to use your machine, and you need to use it every night, all night, on vacation, when you nap, you know, all of those other types of things, that it's not just something that, you know, your physician wants you to wear for 2 or 3 hours or not take on a vacation with you. You know, if you have been on a plane recently, you have probably seen about 4 or 5 other people with some sort of CPAP bag that they have sitting next to you. At least I do. Maybe my eyes are a little attuned to it. But yeah, I mean, I definitely want new patients and people that are new to know that you're supposed to wear it every time you sleep, which takes place at least once in a 24-hour period if you don't. Yeah,
Great point. Yeah.
So the next slide.
Sure.
I cannot tell you how many people who wear a CPAP mask mistake the abbreviations CPAP for CPAK. In fact, I read CPAK is one of the Google's most frequently searched terms relating to the therapy of sleep apnea. So of course, learning the correct pronunciations will help you understand your disorder, and it will help others to know what you're talking about. So also, you need to make sure that CPAP is not oxygen. CPAP stands for Continuous Positive Airway Pressure, and it is a breathing therapy device that delivers a continuous pressure of air to a mask worn over your nose and or mouth to help consistent breathing. So this combination is why it's called Continuous Positive Airway Pressure, or CPAP. And it's a fixed pressure of air, and it's continuously delivered to your airway. So this flow of pressure helps to keep the airway open while you're sleeping. And obviously, you know, that's gonna help you to breathe much easier. Your oxygen level is gonna be much better that way as well.
Yeah, you know, and I think we included a slide like this because I was surprised actually that CPAK was one of the number one Google, you know, terms down there, but people do get it confused. And, you know, in the medical field, a lot of people use acronyms, and we'll get to that later. But it's important, that's a very important thing to understand because, you know, regardless of how you get your machine, when it arrives or how it arrives, you need to really know how it works. And I think knowing that it'll keep your airway open and it's not oxygen and it's just supporting that, you know, collapsed airway so that you're not going to stop breathing is very important for people to understand. And that certainly helps with you know, the terminology that people are using and just understanding the actual treatment itself.
I heard something interesting just a while ago because I often associated sleep apnea with saying, you know, I have a sleep condition, which it is a sleep condition. However, it's a breathing condition. You know, that's why my breathing is interrupted. That's why my sleep gets interrupted, you know, so I just thought that was interesting, you know, a way I never thought about it like that before, you know, whereas maybe people that have, you know, something like insomnia, it's a little different, you know,
sure.
That it's a breathing, I'm having a breathing problem while I'm sleeping. So I never thought of it that way.
Yeah. And, you know, nobody wants to feel like they're suffocating, you know?
Right. Right.
So again, this supports the airway, it keeps it open and patent and allows you to get oxygen into the lungs and the vital organs. Right.
I mean, just what you're mentioning about, you know, one of the suffocating and one of the common things that, you know, I'm sure Cyndy has heard throughout her career, you know, I can't wear the mask because I'm claustrophobic and it makes me feel like I'm suffocating. And, you know, getting with other peers in a group like this, in an online group like this, getting face to face, the group that, you know, like Cyndy would have in person, can help you overcome those hurdles that everybody new to CPAP pretty much has.
Yeah, of course. Great. Okay.
Go to the next one.
Yep.
Okay.
All right. So as you can see on this slide, apnea means no breath, and a hypopnea means little breath. So obstructive sleep apnea, or OSA, is a type of apnea caused by a blockage of the airway, usually when the soft tissue in the back of the throat collapses during sleep. And a hypopnea is a partial collapse of the airway during sleep. So the way we measure the severity of your sleep apnea is with the apnea-hypopnea index, or the AHI, and that's something that you'll hear a lot. It is the number which is calculated by the number of apneas and hypopneas that occur each hour, or another way of putting it is it's the number of times per hour of sleep that your upper airway partially or completely collapses. So in numbers terms, an AHI less than 5 per hour is normal. 5 to 15 per hour is mild. 15 to 30 is moderate. And an AHI greater than 30 is severe. So those are the kind of numbers. It's really important for you to know that. And again, you're going to hear AHI a lot.
Yeah. You know, when we discussed this slide too, I think it's important now that a lot of machines you can monitor every day what your AHI is, and it's important for you to know this. And again, as we go through this, I keep thinking that if somebody's newly diagnosed, this is all overwhelming. But it'll become second nature, because when you get used to your therapy, you're monitoring it, which we would like you to do. All these things will help you understand exactly what's going on with you during the night when you sleep. So if you've started off, hopefully, you know, not with over 30, but some people do, but if you've got, you know, mild to severe sleep apnea, and you see with therapy that that's decreasing every night that you sleep, then it's actually good motivation for you to say, well, this therapy is working for me, and now I'm down to 8 or 10, for example. So, you know, again, when you think that you're not getting that breathing and oxygen that's serving all your vital organs, we will come to that later, but, you know, there's so many now that's coming out there, and I'm sure there'll be a lot more comorbidities associated with sleep apnea. So it's not just a problem that you're snoring or you're not breathing at night. This is a real concern. So it's a really important slide for people to understand and keep in tune with their therapy.
And I just wanted to mention one more type of apnea, which is less common form of apnea, but it's central sleep apnea, or CSA. And unlike obstructive sleep apnea, the airway is not blocked, but the brain fails to signal the muscles to breathe. Sure. So I just wanted to mention that one as well.
Yeah.
Next slide. Oh, go ahead.
Yeah, I just wanted to say one thing. One time somebody told me that, you know, having sleep apnea is like running a marathon all night. You know, you're as you talk about all the effects that it has on your body and all of your other organs. You know, at night, you're supposed to, your body is repairing, sleeping, you know, and getting the restorative part of its day. And when you're constantly having those interruptions because of breathing and some other things that might be happening with your apnea, you know, your heart is working extra, your lungs are, your stomach is, everything's, your muscles are, everything is. And so you're really not getting that downtime. You know, that could be why maybe one of the big complaints is that you feel so tired during the day because you're not getting any of, you're running the marathon at night.
Yeah, and you're not getting that REM, you know, you're waking up before you go into that phase.
Right. And you're waking up over and over and over again, and you don't even really realize it.
Yeah. Which is good, because I think the next slide can speak a little bit more to that too.
Yeah. So have you ever been kicked out of a room or maybe even a house because of snoring? About 90 million Americans suffer from snoring during sleep. Well, half of these people are simple snorers. The other half may have obstructive sleep apnea. So more than just being noisy and interrupting other people's sleep, someone who snores may have sleep apnea, and sleep apnea can have serious health consequences. And just like we were talking about a minute ago, there is evidence that OSA leads to greater risk of high blood pressure, heart attack, stroke, congestive heart failure, atrial fibrillation, diabetes, certain cancers, and even sudden death. It can trigger the release of stress hormones, can change how your body uses energy, and makes you feel tired and sleepy during the day. In addition, untreated sleep apnea may be responsible for poor performance in everyday activities, even such as work and school. So, and the majority of research indicates that obstructive sleep apnea is a significant cause of motor vehicle accidents. And snoring has been long considered a warning sign or a risk factor for developing obstructive sleep apnea.
Yeah. So I know most of the people that are probably out there that are watching this, we know this is serious. Again, evidence is coming out, you know, a lot to say how serious it is. I think you look back at 10 years ago, maybe just people thought, well, you're not getting a good night's sleep and you're snoring or you're tired all the time. Let's see if this therapy will help you. But it's interesting now that it's been attributed to so many diseases and, again, comorbidity factors that are serious. So I want you to consider that when you're thinking of, you know, do I have to wear this mask? It's so obstructive for me. Or, you know, I was talking to the girls last week when we were just, you know, practicing for this session. And when I was at the office one time getting my new mask, a newly diagnosed patient who was probably in her late 50s or early 60s. And, you know, I got my mask, my tubing, whatever. And she's like, do you wear that every night? And I'm like, yeah. And she's like, not that I have long hair. But she was concerned. She was like, but doesn't it wreck your hair and mark your face? And I'm like, believe me, it's better than having a stroke or atrial fibrillation, you know? And this is the kind of down and dirty sometimes where you have to get to people, because it's not a vanity thing. It's not a, I just want to be waking up energized, which is a benefit, of course. It's, no, I don't want to develop heart failure or, you know, a stroke or sudden death. So it's very important for people that are out there that may be tuning in tonight that are thinking, am I a candidate for this or not? Go get a sleep study. You know, go get a sleep study and they will figure it out. For me, you know, I'm a healthcare professional. I knew I snored and I could wake myself up by, you know, snoring and stopping breathing. And I used to think it was a panic attack. I also used to think that the lack of energy that I had was just due to aging. Now, I was lucky enough, or unlucky enough, whatever way you look at it, that someone videoed me while I was sleeping. And I could see the position I was in. I was lying on my back with my arms above my head. I think I've said this before. My legs wide open, but that was for me physiologically to try and get air into my system. It was my body's way of saying, you're not breathing, you're not getting the oxygen, you need to lie in this position and get air into your vital organs. So if you're someone who lives on your own and maybe does wake up, you know, gargling or with a panic attack, consider doing that. Consider doing a sleep study, because no one maybe can tell you that there's something fundamentally wrong with your sleep pattern.
And I just want to say that the sleep studies now are much different than they used to be. They still have the in-lab studies, but they have a lot of home sleep studies, which you come in, pick up a machine, take it home, and you just bring it back the next day. So it's, you know, it's nothing like it used to be. They still do some of those, but most of it is just home studies now.
I would like to just give a shout out to the bed partners or roommates of a major snoring individual, and you know, talk about that for a moment, because you know, sometimes a lot of people don't think about it, but you know, your sleep is getting fragmented and interrupted as well by this other individual's problem. And so it is actually in everybody's, both people's best interest to, you know, talk to your healthcare provider and, you know, see what the problem is and what can be done about it. Because whether you are waking up unknowingly due to sleep apnea, or you are woken up, you know, 5, 6, 10 times a night because you're nudging your bed partner to stop snoring, they're both you know, not giving either individual the type of restorative sleep that they need.
Yeah. You know, and I think sometimes when we were looking, you know, last year, Justine, when we were doing these slides, it's almost like I remember thinking about this slide and thinking it was a little bit redundant, because we were capturing people who maybe already had just a newly diagnosis. But there's also the question of you're newly diagnosed, but maybe you realize that your own sleep partner is doing the same, but you've been too tired to realize. Mm-hmm. Or, you know, someone comes along to you and says, oh, I wake up tired and I'm, you know, I think I'm snoring, or the people next door tell me I'm snoring. I used to hear the guy, you know, where we lived, we were neighbors in San Francisco, old wooden building. I heard my neighbor upstairs snore. Right. So it's almost a way of like, I thought, yeah, this slide's good because it makes people think about how we can help other people in the same situation.
Yeah. Yep.
Right.
Okay, so this slide is pretty self-explanatory. It's just showing the difference between an open airway versus a blocked airway. And that's, you know, you can, you know, definitely see the difference.
Mm-hmm.
Yeah. You know, and I think a narrowed airway, you know, when you look at hypopnea, it's even a narrowed airway, you're not getting the same vital oxygen and airflow. Obviously, a blocked airway, we have sleep apnea. So again, you know, the therapy is induced to keep that open and patent so that you can get good breathing and oxygen.
Right.
So, yeah.
When I was, I actually do not have sleep apnea. I have UARS, upper airway, I say resistance syndrome. I think that's the right word for the acronym. You know, instead of holding my breath for 10 seconds or more, I hold it for 7. Sometimes it's, you know, my own personal statement with having sleep apnea or a breathing condition while you're sleeping is that it's kind of like in that realm of, well, are you pregnant or you're not? Because you either are or you're not. You're not right. A little bit. So, you know, am I breathing like I'm supposed to while I'm sleeping, or am I not? And so even when it's narrowed, I mean, yes, you are, you know, it's a hypopnea. You are still breathing. Your AHI that Cyndy talked about before would be lower than actual having a blockage, but you know, it's something you definitely want to keep an eye on because, you know, as we get older, as you were saying before, Kevin, you thought your low energy and so forth was just, you know, related to aging. And I mean, you know, none of our tissues and muscles stay as taut and vibrant as we age, including your airway and all the muscles there. So, you know, that's just something to keep in mind, you know, about that.
Yeah, great point. Yeah.
And so this is what a breathing looks like on a sleep study. On the left, the waveforms represent normal breathing while sleeping, and on the right, the waveforms represent abnormal breathing. And in this case, you can see that there's really no breathing at all. So this would be an apnea. And this can happen hundreds of times a night, night after night. So that's why everybody's tired.
Yeah, and you know, I love this slide because I think as we talked about this before, everybody understands, we all watch, you know, medical programs, and everybody understands a flat line, you know. If it's an EKG monitor and it's a flat line, it's like, oh, they've gone, you know. So obviously on the left, we have a beautiful pattern of, you know, consistency. And on the right, you know, there's some variance, and then there's a flat line. So to associate that flat line, we're not saying that, you know, someone's flat lined, but it's like that's no activity at all. So I think people, especially people that are out there that are more visual, can understand that, oh, is that really happening to me? you know? And, you know, as much as you can tell people what happens to them as far as AHI as a number, I think if you saw somebody, you know, or somebody who was more visually minded that seen that in a graph form would understand that really this is what's happening to me every night. I go a beautiful waveform and then it just goes flat. So I think that's a great slide for encouraging people to, you know, adhere to the therapy and understand how important it is. And again, even though this is for people that are newly diagnosed, we want to instill the importance of the therapy by reinforcing what can happen when you're not on it. So I really liked this slide actually when we were doing it.
Yeah, this kind of reminds me, you know, when I look at the right and I see those high peaks and valleys, I think of that marathon that I was talking about before and you running. Because I'm sure, you know, as I'm sitting here at the desk, my breathing is probably pretty much like the left, you know, in and out, nice and smooth. But if I started to run a marathon, I'm pretty sure my breathing would be, you know, all these, you know, big inhalations and exhalations. I'm sure they would continue, you know, hopefully I wouldn't hold my breath that long while I was running. But nonetheless, you know, that's when you're sleeping, that's, you know, an interesting thing to consider, that you're breathing that hard while you're sleeping, you know, trying to get that oxygen to the rest of your body.
Yeah, because it should be a restful phase. Right. You know, when we're sleeping, that's when we rest. So you want a nice rhythmic, beautiful breathing that's calm. You don't want all these variances where you're struggling and then it's, you know, you're struggling to get air in. And like you said, the peaks and valleys go up and then there's a flat line. You know, obviously not good.
Yeah.
SA, OSA, CSA, AHI, PAP, CPAP, APAP, BiPAP, DME, HME. Now we have a good idea what all these letters stand for, I hope. When I started in the sleep lab 19 years ago, I had no idea what most of these abbreviations meant. It looked like alphabet soup to me. Does anyone else think so?
Yes, definitely. And, you know, as I think I said to you in our practice session, you know, people in the medical field, they use abbreviations. And because it's easier to say, you don't have to splur out these big continuous positive airway pressure. You can abbreviate to CPAP. I think the important thing about this slide here is just, it's not to overwhelm people about all the abbreviations, but people speak in that language, and it's just important to know what they're talking about. You know, being the most important is, you know, ASAA, sleep apnea. I think, you know, when we talk about AHI, I think that's really important to understand what that means. PAP, positive airway pressure, or it can be called CPAP or BiPAP or APAP. They're all good to know what each individual acronym means. So people that are talking to other people, maybe in peer-to-peer groups, may use these terms. And I think it's okay for people, like I'm in the medical field or nursing field. Sometimes I read something and it's abbreviated and I'm like, what is that? And then when someone tells me, I'm like, you know, but terms can be dangerous as well. But I think they sound a lot, and it does sound like an alphabet soup, but they are related to our issues that are going on. So do try and familiarize yourself with these terms, because people in your community will probably use those as well.
And they're a lot easier to say.
Yes, yeah.
Now we should have a good idea what these abbreviations mean. I think we have touched on all the abbreviations except for the last two. We didn't speak about APAP, which is much like a CPAP machine, but instead of giving you a continuous pressure, it automatically adjusts the pressure. to meet each specific person's breathing needs, which often changes throughout the night as we change positions and we go in and out of different stages of sleep.
Yeah.
So, and the last one was the BiPAP, which is a breathing therapy device as well, but it delivers two distinct pressures, one for inhalation and the second for exhalation. And this is usually used for people with very high pressures or for people with lung disorders or certain neuromuscular disorders. So I just wanted to also touch on those as well.
And that's important.
So in conclusion, I think the more that you know about your diagnosis, the more questions you can ask others, and the more they will be able to help you, and you'll be able to help others.
Great, Cyndy. Very good. Thank you so much. I really appreciate that. Now, one question I do have. I know you haven't used these particular slides because they are new, but you do have a lot of participants in your class. Can you just give us an example of some of the questions when someone is newly diagnosed? What are some of their fears, anxieties, or questions around the whole therapy that they get?
I think most of the, the questions that end up being asked are the more simple ones, but, just about the face mask and, which face mask should they use? Should they use a full face mask or a nasal mask or a nasal pillows? What is the difference between them? How long do they have to wear their mask, and do they have to wear it every night? Do they have to bring it, with them on vacation? A lot of them try and ask the manufacturers, like we talked about earlier, about different headgear so, it doesn't mess up their hair. The straps on the face and the lines. All of those things are things that they kind of talk to each other about and, help each other figure out maybe, if you try this or you try that, then, it might work for you because it works for me.
Right. And I think one thing that we talked about during the week was, when you do get your quote-unquote prescription from the doctor, I think you had said that you help navigate that system because some people are overwhelmed by, am I going to have to go and pick up the machine? Is it being delivered? How long will it take? Can we just expand on that a little bit to, share experiences about what happens after you do get a prescription?
Sure. I think for most, it's really different depending on what your insurance company is, who the home care company is, because you will either go to pick up your machine or some home care companies do come to the house, and then some may actually get mailed. So, but you need to keep on your doctor to make sure that the prescription was written. And then, like I said earlier, make sure you know the name of the home care company that they're calling for you. And that way you can, talk to them as well if you need to call them.
Sure.
One thing, can I just chime in on
course.
that topic for a moment? Thanks. One thing I'd like, new patients to know and to realize is that, your insurance will probably dictate the type of equipment company that you are able to go to. However, the most of the equipment that they have there, they might only show you a small portion of what actually is on the market. So, if you are so inclined to, research a little bit about machines and masks, and just because they show you these 5 nasal masks doesn't mean that that's the only 5 that are out there. There's hundreds out there. So, you might want to, if you're not feeling satisfied with the options that you're getting, probe a little bit more. I mean, there are tons of resources online that, you can look at all different types of masks and machines and this, that, and, talk to your DME about, wanting to try something that they haven't shown you if you think that that might be helpful for you.
Sure.
That's also, when you go to the A.W.A.K.E meeting, we have a lot of vendors there. We have a lot of manufacturers there, and they usually will bring their newest supplies with them. And then, you can also ask if you have looked online, saw something that you wanted, you can ask them and see if they have, if they brought it with them. So.
Cyndy, I want to play devil's advocate, okay? So, say for example, we have someone who is visually impaired. They get their box in their machine in a box, sorry. And is there opportunity or resources for someone to help sort them out, set it up? Because they've got this new equipment, they don't really know what to do with it. Are they instructed about that before they leave the DME or office?
Yes, they're whether it's done at home or whether they go to the office, they do explain to them how to use it. Obviously, what kind of water to use, putting together the mask, cleaning the mask, that type of stuff. I'm not sure what happens if it gets mailed to them, and every once in a while that does happen. So I for some reason, I think there might be like a video that comes with it or something, but
Sure. I mean, obviously we've got a variance of people with different disorders, different things going on, and I'm just like curious to see. I mean, I was given mine on hand and someone showed me, set it up, use distilled water, plug it in, put it on, sit and read a book, and away you go. But some people can be overwhelmed with new equipment and thinking it is very easy. We all know that. But others may feel, a little bit overwhelmed. So I'm just wondering if, those resources exist, and that's good.
Yeah, I think they do. And I think that, you can always call them back as well and make sure that, if you do have a question, that they will answer it for you.
Sure.
And if nothing else, they can call the sleep lab and we'll help them.
Good.
I have a Facebook question here from Victor.
Great.
And this is a common thing a common question for people that are starting out on their CPAP treatment. I'm sure Cyndy has heard this before. That Victor's problem is stuffiness when he wears his full face mask. And he feels he's tried every adjustment and nothing seems to work. And in fact, he feels like he gets less sleep using the mask because he's often, feels like he's waking up and fidgeting with it and this, that. And are there any suggestions that maybe you can think of, he could see if he hasn't tried yet?
Probably even I'm not sure if he uses a nasal spray. We have the neti pots, that type of stuff that may help. The adjustment of the humidification, maybe something as well.
I would even maybe suggest too, if, constant stuffiness might get you in to see an allergist.
Yeah. And I was going to say that actually, Justine, it's a great point because I actually, now the weather had got cooler and I'm using, in my apartment, it's dry heat. It's like, forced air. So the first symptom I had was like sort of dry, itchy skin. And then I was like, oh, I need to go back down to storage and get my humidifier back out. And I actually realized when I had my humidifier on in the bedroom that I felt like my whole sleep was better, even though, of course, I'm using the humidification in the machine. But it just created a nicer environment as well. But I think you're right. I mean, there could be something else going on and not just the mask or therapy. So I would try and sort that out first, but look at some humidification in the actual environment as well.
Yeah, I mean, if you just are a person that has various types of, environmental, therefore nasal allergies and inflammation, it's going to be hard to breathe when you're sleeping anyways, whether you wear a mask or not. So maybe seeking some help on that matter might be able to resolve it for you.
Yeah.
Okay.
Any other questions?
There was a question here. Let me see on this chat from Janet, but we might have to talk offline to Janet. She was hoping to get some information about coexisting insomnia. She's been a successful BiPAP user for several months. Her events are under 3. But it sounds like maybe she's having some insomnia now. Have you had any of that with some of your patients or group attendees, Cyndy?
Not really. And if, I would first say that, maybe she's just having a hard time getting used to the machine and is not sleeping. But if she's, been on it for a while, then I'm not sure.
Yeah.
Yeah.
At this stage,
this is adjunct therapy. There's other, sometimes we hear, even when I look at the A.W.A.K.E Facebook page, and some people say I started with a mask and the expectation is to, oh my God, I'm going to feel really great. And certainly I did, I can't deny that, but not everybody has the same outcome. But you also have to bear in mind, like, Victor earlier, with maybe there's something going on sinus or environmentally or allergic reaction. That, there's something else going on in this. CPAP or BiPAP or A.W.A.K.E just doesn't fix anything. It'll help alleviate your OSA, but you have to be mindful that there could be other things that are going on, and, you should look into that as well.
Yep, fully agree.
Any other questions, Justine?
I don't have any other questions. We had a lot of comments, and someone had said, no questions, just thank you for doing this and the work that you're doing. So that's great.
Okay. Well, listen, I wanted to thank Cyndy again, and it is great when we reach out to participants in our group and they're willing to come on and get out of their comfort zone and do this. I think it's wonderful, the work you're doing with your patients, and certainly it has motivated me as well to start a group here. Watch this space. And again, always, Justine, thank you for contributing. You're always great and a great advocate for the patients that are suffering with sleep apnea and various sleep disorders and COPD. Lots of great work that's been done there.
Thank you.
We always welcome as well questions or, comments or topics that you may want. We're going to try and run these every month again this year. So if you have something that you're particularly interested in that you want to hear about, or you even want to bring yourself forward and discuss some things yourself, we'd be happy to have you on board.
One thing before we part with our audience, we talked a little bit about it in the beginning about the ASAA's A.W.A.K.E network and the groups, peer-to-peer groups that Cyndy and other individuals like her have across the U.S. We are really trying to make a push to increase the number of groups that we have this year. A.W.A.K.E has been around, I'm blanking on the year right now, but since 1990, I believe. So it actually was started as a peer-to-peer group with patients helping patients and talking about their experience and what did you do with this and how did you overcome that. And that's all very helpful. It's exactly what we're doing tonight. And that information is always helpful to someone that's new or, someone that's experienced always has information to give and to share. So that's great.
Yeah.
There's a lot of individuals like Cyndy who their clinic or their office or their healthcare organization, runs an A.W.A.K.E group in a particular area, and that's great too. They have the resources to experts and healthcare providers that can give a little bit more detailed information than a peer can, but they're both still very helpful, to patients. So, if anyone is interested in starting a peer group, you can visit our website that's up there, www.sleepapnea.org. I think it's funny, I just said the www part.
Yeah.
Just sleepapnea.org.
Yeah.
And if there's, people that want to encourage their doctor's office to start a group, they can tell them to visit our website and take a look at it. The type of materials that you saw today are what we're providing individuals and groups that Cyndy and others are running. To help with the messaging and give you the tools that you need to start the discussion and keep the discussion going. So,
yeah, and I think it's a great point. And I mean, again, we want to motivate people to do this. But if you feel you're somewhere and you feel alone, nobody wants to feel that. And yeah, there's great resources out there with our A.W.A.K.E Facebook page. But if you're the type of person like me that likes, contact, discussion, more narrative than written, maybe just consider opening up a group where people can meet periodically and just discuss things. And even if it doesn't have to get that clinical, just talk about your experience and share your experience and just know that there's other people out there like you, helps you, adhere to therapy and think that, this is the norm for me now and I'm going to work with it. So it's a great idea. It can be social, clinical, informative, however you want. It's great. But as Justine said, we have the tools to provide you with, information that is good and sound.
We had one more question sneak in from Carol before we break up. I think it's a good one. How often should you be checked? So here you are, you got your diagnosis, you got your machine and stuff. What comes after that with going to the doctor? Are you going to have another sleep study? Do you have to go back to the doctor every month, or what's the process? Maybe Cyndy, can you maybe paint a little picture about what happens?
So I think at the beginning, so we have a clinic at our place. So at the beginning, you would go, after you're diagnosed, then you would go a few months later. Then you would go yearly. But having the sleep study over again doesn't usually happen unless your symptoms return, if you've, gained weight, lost weight, that type of thing. And then you would have another sleep study.
Sure. Can I just share my experience, what it's like here in Canada for me? I go every 6 months to the DME, and, mainly for supplies. They check my machine. They check quote-unquote adherence. Those reports, I'd asked about this before, are funneled back to the doctor that I'd seen initially. And if there's a problem, for example, if my setting needs adjusted, then they would alert the physician to say, well, actually, Kevin's having more AHIs. I think his setting needs to be increased or not. So, it's not just to look at adherence. They're always happy to say, oh, you're doing at least 7.5 hours a night, and that's great. And your AHI is down to 3, for example. But it's also to funnel back again, like I said, to the physician to say, well, maybe this is the problem now because there is a lifestyle change, there is a weight gain, there is something that's making the AHI increase, and therefore you would need to go back to your doctor's office and see them about adjusting your therapy. I don't know, Cyndy, if that would ever, include another sleep study. I think they can get a lot of information out of the machines these days to not need that. So yeah, for us, it's every 6 months.
Great.
Okay.
I think that might be it with the question.
Are we good to wrap?
I think so.
Listen, thank you guys. And again, I encourage your comments, questions, and we will try and get to them. We're not experts. We can only share our own experience. And but if you have a topic, again, that you'd like us to discuss, or if you're someone out there who would like to come on to our Facebook Live, please feel free to jot us down or jot us a line and say, I'd be interested in discussing this, and we'd be happy to have you on board. Thank you so much again to Cyndy and Justine. Good night all and sleep well.
Bye.
Bye.